Welcome back to the morning show here on Arise News. I'm Nkechi Nana.
And I'm Rufai Oseni. Air ambulance service as a business usually aligns with the norms in the country of operation. In most developed capitalist countries, the norms are usually similar. But in developing countries where socialist policies can constitute some government roadblocks, the norms vary a lot.
Here in Nigeria, air ambulance services have been described as the enabler that will improve Nigerian healthcare by improving access to hospitals and saving the government many billions of dollars.
So joining us now in the studio for a chat on the air ambulance business in Nigeria is British Nigerian medical doctor, Managing Director of Flying Doctors Nigeria, Dr. Ola Brown. So I don't want to call you British Nigerian doctor. Nigerian doctor. British Nigerian doctor, yeah. Nigerian doctor, Dr. Ola Brown. And it's a joy having you here. But let's start from your article. You know, the article you put out on Medium.
Okay.
You were talking about doing business in this part of Nigeria. And the stark reality is because a lot of us are so quick to download the India model. I would think it's like plug and play, it's going to work. Oh, we have Keke Marwas in Nigeria, they have Shawalas in India. So it's just going to work like that massive population, I think. But you said things are really different. And you made us see that 98% of the Nigerian population, according to NDIC, don't have up to 500,000 naira in their bank accounts. Can you tell us more about that report?
So it wasn't really a report. I go to India quite frequently, and I used to think that India was exactly the same as Nigeria in terms of demographics. So any business that has worked in India, I just assumed that it would work in Nigeria. But I got to spend some real time in India, not just landing and taking off. And the area that I was staying in India had like 5 Starbucks. And they were selling just cake and coffee for like $10, and they were full up. So I started to wonder, is there a difference between sort of the purchasing power or the number of people with high purchasing power in India and the number of people with high purchasing power in Nigeria? And the more I researched about it, the more I realized that, India has a huge number of people with high purchasing power. I call them India One, so people that earn $9,000 or above. And there are about 100 million people. Whereas there's a McKinsey report that looked at households in Nigeria, and it said about 2 million people have the same purchasing power as 100 million people in India. That's over $9,000. So really, if you're earning around 3.5 million in Nigeria, you're really in the top echelons of society, and there are only around 2 million people like you. Whereas a lot of businesses, when we're sitting and designing our business models, we design for that top echelon. But there are actually very few Nigerians like that in Nigeria 1. But when you come down to Nigeria 2, you discover that there's a lot more, about 80 million people in the earning bracket from about $2,000 a year to $9,000 a year. And not many people are targeting them. But the companies that have targeted them have done very well. So Indomie noodles, for example, Chivita drinks, for example, the beer companies have done quite well. The pasta, sugar, salt, so Dangote group have done very well by targeting this midsection, whereas it's very, very difficult to scale if you're only targeting people that are in Nigeria 1.
So all of these top luxury brands that are coming into this country, are we looking at this? Because that report also talked about the fact that we have only about less than 13,000 millionaires in this country.
Compared to 300,000 in India.
Yeah, and let's just down on the brands a little bit. They're not paying us for sponsorship and the likes. Yeah, so only about 13,000 millionaires.
Absolutely.
In Nigeria?
So it's quite shocking because there's 40,000 millionaires in South Africa, despite the fact that they have less than a quarter of our population. So we actually have quite a small number of millionaires. So if you're targeting that market of millionaires, you're really only targeting 13,000 people. And if you're doing the same business in India, then you have 300,000 people. So there are more millionaires in Delhi or Mumbai than there are in the whole of Nigeria.
So I mean, this is still on the market size research and article you wrote pretty much on Medium. Are we taking in all these numbers and are we using it well to be able to make business decisions? Because apparently...
I think we could be using the information better. So, for example, I think that digitalization is a great idea. And I wrote in the article that digitalization is the way to bring huge amount of Nigerians into things like financial inclusion, etc. But there's good evidence. We know that the banks that have more physical infrastructure actually, for now, take more deposits. So I think that there always has to be a balance between digital applications and also using offline structures to also increase things like financial inclusion. And that will go for insurance, that will go for almost every business that you're doing. Even one of Nigeria's most successful businesses, which is betting, you can see that they have physical structures everywhere. And again, like our churches, for instance, they have physical structures everywhere. They're not doing internet churches. And these are some of our successful sorts of organizations that have scaled in Nigeria, but they've scaled with a balance of online offerings and offline offerings.
So your business of air ambulance, what sort of social class in Nigeria patronize your business? Do you think the middle class and also the lower classes can afford to patronize your business even in dire emergencies?
So I think that this is something interesting. So the article was actually targeted at consumer businesses. So these are businesses where you have a product and you're selling directly to a consumer. So with the air ambulance business, I don't think there's anywhere in the world where it's sold directly to a consumer. So we sell mostly to insurance companies. We sell to brokers that make it cheaper for the end user. So I believe that definitely air ambulance services are not only accessible, but almost essential because of the way that healthcare works. Even in England, or America, or Germany, or Australia, air ambulances actually aren't a luxury. They're just a way that government saves money. So in Australia, which has sort of the oldest air ambulance infrastructure, the air ambulance in Australia was started in 1923. It was started to avoid the government having to build hospitals everywhere. So imagine having to build, I mean, one of the most expensive hospitals in the world is in Dublin, and it was $1.2 billion to build. It's a children's hospital. And because of the air ambulance system in Dublin, they only had to build that one. And all the children with rare diseases can fly in and be treated in that one. But imagine if they had to replicate it everywhere in Ireland. And the same way in Nigeria, if we're going to spend $1 billion on a hospital, you cannot afford to do that in every state. If you did that in every state, then you'd be looking at $36 billion, which is more than our entire budget put together. So air ambulances aren't actually a luxury. They're just the way that government saves money so that more people can access fewer hospitals, basically.
But the case in Nigeria is still a far cry. I mean, what did you meet on ground when you came into Nigeria to start this air ambulance business, and how did you start?
Well, people say it was an innovative idea. I'm not sure that it was, because obviously the air ambulance industry is very, very well established. The air ambulance companies listed on the American Stock Exchange, for example. They're some of the most successful healthcare companies in America. So I wouldn't say it was an innovative idea. It was just innovative in our environment where the healthcare systems are not yet developed. So what I met on ground is a system where a lot of the medical community didn't even know what an air ambulance was. So there had to be a lot of education. There had to be a lot of new thinking in terms of how could we adapt our business model for this environment. And while we started with planes and helicopters, and we thought that this was going to be the only model there was because that's what is available abroad, eventually we actually started working with airlines and offering a much cheaper service where we could remove some of the seats in a commercial aircraft and put a stretcher in with some medical equipment and reduce the price to almost 90% less than it would cost to do with our own aircraft. So sharing facilities with airlines that were already going in that direction. So we've evolved our business model over time, and we've also evolved our geographical spread. So one of the things that I didn't mention in my article, but I think is important, is if you can sort of expand the market. So when you have aircraft, when you have access to large regional airlines, then you can expand your market beyond where you are. So our market, for instance, is very, very different from the average Nigerian consumer businesses market because we cover a market from about Congo, Equatorial Guinea, Brazzaville, right up until Burkina Faso. So we have a market of several billion people that we cover across the region. A lot of our transactions don't even involve Nigeria. So the last flight that we did over the weekend was, I think, Liberia to Accra, for instance. So Accra is one of the centers for medical tourism in West Africa, at least. A lot of people want to go into Accra for treatment because it's high quality, low cost medical facility. Yeah, Accra is like the biggest center for everybody in West Africa to go. And we're hoping that Nigeria can eventually maybe take over that.
So obviously that means centers in Accra like Kolebu are fast becoming... Because I've been to Kolebu once and I'm like...
Yeah, absolutely. So that's one of the most famous centers in West Africa. And you see everybody from all over requesting to get treatment there and be flown there from other West African centers. And that's really the future of healthcare. Maybe in countries like Australia, countries like America, they're not flying people out of America, they're flying people interstate. So about 40% of air ambulance transfers are interstate in America. So even looking at America, they cannot afford to put the same facilities in every state. And some facilities, there's only one of them. So there's nowhere in America that has the level of infectious diseases facility that the one in Atlanta does, the Emory Center, because you can only really put one of that. There's only one Mayo Clinic, for example, where all the things that people have tried to diagnose and failed, they go into a super center like the Mayo Clinic. All the ones that people can't work out, the doctors have tried in different states and they're all confused, they go into Mayo Clinic for advanced diagnostics. So even in America, there's certain centers that there can only be one of. And I think in West Africa, you'll see a lot of movement around the subcontinent, around the region, because definitely I think some countries would have to put money together to get a center like Mayo Clinic. But once you have it, then there can be a shared facility where people can move around. And really, that will be the future of our healthcare. Well, we can have those facilities, but maybe not as many, as a high density as countries like America and Australia and Europe have them. And that's okay. I mean, in India as well, I think the game changer for them in their healthcare was when they started doing these super specialized industrial healthcare centers, the super specialist hospitals they're called, where they were able to just do a lot of numbers of different surgeries and where they were able to get high volumes of people in. And I think in terms of numbers and efficiency, they do far better than America. So I did some statistics where it showed that there's a center in India that does the same number of heart procedures in a month as one of the best American hospitals would do in a year.
Wow.
With the same level of morbidity and mortality, so the same quality, but they're just a lot faster and more efficient.
Yeah, I mean, that leads me to this question. I mean, if India can democratize healthcare and heart surgeries, and I remember in the 80s, it wasn't like that until a certain doctor called Dr. Devi Shetty came back to India and democratized it. I think he was working at the Royal Hospital in England, and he came back to India and he democratized heart surgery. And we're hearing about things like Accra, Kolebu being a center for hub. What is happening to our University of Ibadan teaching hospital? What is happening to the teaching hospital in Jos? In Lagos. Why can't we be the hub?
I think it's a combination of things. And I think that really, once there's a lot of policy that goes into an area and policy concentration, the industry changes. And that's always been the story in Nigeria. So one day, our leadership woke up and said, you know what, our ports are crumbling. They cannot even support the amount of cement that we're bringing into this country. And all our forex was going on cement. So they called all the people that were probably capable of producing cement and said, okay, how do we produce cement? How do we become self-sufficient in cement? And within a few years, we're able to achieve that. The same happened in banking. I can remember looking at a time when there were over 100 banks in Nigeria. And the banks were so unreliable that you put a deposit in and you're not even sure whether the deposit will come out again. And there was sort of, right from the top, there was sort of a policy direction that, look, we need to reduce the number of banks. We need to consolidate the number of banks. We need strong, efficient banks. And that industry was transformed. At the end of that exercise, from over 100, there were like, I think about 12, 15 banks
we'll
remaining.
We'll go on a quick break. We'll come back and talk to the very amazing Dr. Ola Brown. We'll be right back.
Welcome back to the morning show. We're still with the Nigerian doctor, managing director of Flying Doctors Nigeria, Dr. Brown. And before we went on that break, you were talking about the government focusing on one particular sector. Now, you're obviously in the health sector. Some people may argue that your business thrives in the government having collapsed the health sector. Do you think your business model depends on collapsed infrastructure or health sector?
Well, I think Australia has the best, one of the best. I mean, if you're looking at the countries that have the best healthcare in the world, then I'd probably say Germany, Switzerland, Australia probably have the best in terms of access for the poor, in terms of affordability for the poor, and in terms of quality. And they also have some of the most sophisticated air ambulance services in the world. I went to go and visit the Swiss air ambulance, Riga, and I was blown away. That's like a major operation. The aim of Riga is to make sure that nobody in the whole of Switzerland is more than 15 minutes away from a hospital at any time. So they have helicopter stations all over the country to make sure that immediately there's an accident, they're not just flown to hospital, but they're flown to the right hospital. The same with Norway. I think the more advanced a healthcare system is, the more advanced the air ambulance systems tend to be. Because like I explained at the beginning, you can't place that infrastructure everywhere in the country. And I think in a West African context, you probably can't place that infrastructure even in every single country. I think there needs to be a lot of collaboration, regional centers of excellence, for instance, to do that. So there's absolutely no relationship between air ambulance and collapsed infrastructure. I think there's a relationship between air ambulance services and very, very advanced healthcare infrastructure. So Japan, for instance, I worked in a major receiving center in Japan, GK Hospital. It's a private hospital, but it's a major receiving center for certain things. And we received cases by air ambulance from all over Japan. And we're based in Tokyo. But people in Hokkaido that were like, miles and miles away could receive the same standard of excellence within minutes. Because we had a major receiving center that was dealing with high volumes of those cases.
I think the perspective in which you're trying to come from is the fact that, you take people from here to the UK, for instance, for the fact that, if you could fix that problem in Nigeria, that health problem, why do you need to take them from here to
away
the UK?
From Nigeria.
Away to the UK or places even farther than that. That's what she was talking about, perspective of, as you thrive because you don't have centers where you can receive people in this part of the world, in Nigeria, for instance.
Well, first of all, we bring patients into Nigeria as well. So we're a transportation company. You can't say that DHL is sending packages outside Nigeria. That's why they're successful. They're also bringing packages into Nigeria. They're also moving packages around Nigeria. So I'm not sure that... sorry, maybe I don't understand the question, but the thriving of the business is because sick people in dire conditions will always need to be moved from an area where they've overwhelmed the level of care to a more suitable level of care. And that is the same all around the world. And unless you can spend the money to put centers of excellence in every single village, then there'll be a need for logistical solutions for them to get to those centers. So the most advanced air ambulance services are actually found in places that have the most advanced healthcare. And the reason why they're there is to make sure that people just don't die because they're in the wrong place at the wrong time.
All right, another perspective comes to mind. You've been doing a lot of advocacy work. I mean, this is part of the advocacy work. Is there any chance that you might engage people like the African Union to have very coherent regional hubs? All these super centers, the likes of the John Hopkins of this world. Because at least if we have that, and we have probably 2, 3 working, maybe it will cut the medical tourism we go do in India. For things like that in cancer. Is this some sort of like engagement you're thinking of?
I think it's interesting, this point about medical tourism, because I don't think that's a problem. I think we're obsessed with Nigeria, which is like 2 million people, right? So even in the countries that I've been to, like Dubai, for instance, they have fantastic tourism. They have fantastic healthcare centers. But the senior people, politicians, they might still go to Cleveland Clinic. They might still go to Mayo Clinic. But the majority of the population are taken care of in the country. Morocco has great healthcare, but the most senior politicians, they might still go abroad for healthcare, but that does not affect the standard in the country. Most people in Nigeria, probably like 90% of Nigerians, cannot afford to go. They've not even bought a plane ticket outside. So why are you concentrating on the tiny proportion that can afford? People will always go, even Indians, the very, very senior Indians, if they don't like the treatment, they go to Singapore. So there's a huge medical tourism market from India to Singapore. Even if you remember that Malala story.
Yeah, Malala Yousafzai.
They flew out to Singapore because Singapore healthcare is actually like, you know,
but a lot of people will quickly argue with you, saying even the lowest rung don't get quality healthcare. People, I mean, it's still said the Nigerian healthcare system, I think there was a research that came out, it's about the third worst in the world. They rated the healthcare system of a place like Kabul in Afghanistan.
Absolutely,
even way better than the Nigerian healthcare system. Isn't that scary enough?
So I think that it's scary that if you want healthcare at a certain level, the prices may not let you access it. So Dr. Shetty's hospital that you talked about, the same procedure that they're charging $200,000 for in America, it can be done for $10,000 in India at the same morbidity, same mortality, so same quality, and he's still able to make a profit from that. That means people that are relatively poor, if they have insurance, they can afford healthcare. And India, the reason why people are going to India is because it's a lot cheaper.
But the truth is, the lowest of the lowest rung in this country don't have that insurance. There was a scam with the NHIS, sort of like our NHS. The people are still walking free on the streets. Dr. Shetty's hospital talked about in India. Dr. Shetty started an insurance scheme where every local farmer will put in $100 US, and any local farmer could get access to a heart surgery for free.
Absolutely.
But the same is not the case in Nigeria.
Absolutely.
There's only less than 3% health insurance penetration rate. You work with these people.
Absolutely. So I think that these are now the real problems. I think we concentrate on medical tourism, but that's not the real problem. Helping rich people to get surgery in Nigeria is not necessarily the real problem. The problem is how do we provide for those 80 million people that can't afford it? That's a market of 80 million people, but we've not provided a way that they can afford it. It can be through an insurance scheme. It can be through a deduction scheme. Like the diaspora money, we get about 25 billion legally. Not the people that are saying, please help me take £10 to, you know, are you traveling? You know, the legal means of remitting money, we get 25 billion from that. Why can't we take a small tax out of that and say this is going towards healthcare? Or what about the money we spend on our phones? Why can't there be an agreement with one of the, all of the telecommunications companies that a proportion of the money that we spend on credit goes into a healthcare pool? Because the problem with insurance is, I'll tell you a story. I was in an Uber in America, and some guy, when you introduce yourself as a doctor, people naturally start telling you their medical problems. So there was a guy saying that he had just come back from Mexico for knee surgery. And I'm like, but are we not in California? You left all the great facilities here and you went to Mexico risking kidnapping. He was on the border, risking kidnapping, risking being caught up in some drug deal to go and do surgery in Mexico. He went to like a really dangerous part of Mexico to go and do the surgery. And I'm like, but you're in America and you're an American citizen. And he said that the cost of insurance is too high. Yeah. So insurance, if we're using that as a solution, has to be cost effective. If we're going down another route, where we take a tax off of maybe diaspora, we take a tax out of maybe the banks, a percentage of their PAT, sorry, I'll offend some people now, or we take some of the money from airtime, we need a pool of funds that 80, 90, 100 billion people can access. Like I said, Nigeria won. Yeah. The people that are traveling are 2 million households. The people that even travel all around Nigeria, they're not up to 15 million. 50 million passengers a year travel in Nigeria, and that includes the ones that are traveling domestically.
A population of over close to 200 million.
I'm not even sure that we should be concentrating on that and start concentrating on how can we make it affordable, accessible, and acceptable for the majority of Nigerians that can't travel.
You were talking about diaspora funds. Recently, based on all this a saga of fraud and things like that. You know, some states now in America, they're stopping Western Union.
Absolutely,
I mean, money transfers from coming into Nigeria and things like. It's not going to affect our 25 billion diaspora fund?
I think it is, and I think that we need to.
Oh, you think we're going to find a way around it?
No, I actually think we need to rebuild the story, narrative around Nigeria and fraud. And I think that, like, news outlets like you have been doing a very good job, because you're international, of bringing really positive stories about Nigeria to the fore. Actually, all those scams that you hear that Nigerians do is about 5% of the total cybercrime in the world. The biggest cyber criminals and the ones that steal the most money are actually Russia, in North Korea, in Estonia. Those are the barons. But they are managing, those countries are able to manage their image to an extent that you never know. All you'll hear about is these romance stories that somebody was pretending to be somebody's boyfriend and maybe took $2,000. That's not the bulk of cybercrime. the bulk of cybercrime is actually people that know how to code, people that know how to get into the biggest banks. And those people are not Nigerians, unfortunately. Nigerians are just writing emails saying, oh, can I be your boyfriend? Let me take $3,000 or $5,000. It's very minor in the grand scheme of cyber fraud. So I think that we need to change our narrative away from fraud, not saying that we don't have a problem. That problem needs to be tackled, but also saying there are very, very positive things about Nigeria and use our soft power more. America, their music, their film, it has a huge influence over the world. And our music and film will continue to do that. Our media, our creatives will continue to do that. So I think that we need to have a more balanced narrative about Africa and a more balanced narrative about Nigeria. It's not just about the fraud, and we need to be more vocal when we're negotiating with these countries and negotiating with these countries and say, look, in the grand scheme of things, yes, we have a problem and we're tackling it, but in the grand scheme of things, we also have very, very good things to offer the world, and I'm not sure that we've packaged those things well enough.
Exactly. That's really important, changing the narrative. Now, talking about positive things that Nigerians are doing, you don't only focus on saving lives, you also focus on improving lives, talking about corporate social responsibility. Can you tell us some of the initiatives that you undergo, especially focusing on female advocacy, because I know you're really vocal about that?
So there's two sections of how I use my time outside Flying Doctors. Number one is venture capital and angel investing. So I believe that getting startup capital, getting growth capital is still very difficult in Nigeria and still very difficult across Africa. Africa itself only achieves, it contributes more to population than it does in terms of the capital that we receive. So, of course, we're undercapitalized. So I think it's very important for Nigeria to have growth capital. And you talked about charity, which is the other side that I do. But I think that Africa will be built by business. And sometimes I go to a lot of these events abroad and they're like, oh, all we need is more NGOs and more charities. I said, in France, did you build your country from NGO? Or did you build your country from charity? You built it because you have big companies. Well, somehow you don't want us to have big companies. You want us to be doing charity. So I have a firm called Green Tree Investment. We are 3 directors that started, and we invest growth capital in companies. Then on the charity side...
we need to go now. I know you need to talk about it. Definitely we'll bring you back here to talk about even more things. Thank you so much, Dr. Ola Brown Founder.
Thank you so much.